I am Mustafa Bittaye. I was trained here, my primary school at SDA, secondary school, but I went through but I finished at SDA, then high school at SOS. Then I did my university undergraduate here. We were the first batch of doctors trained in Gambia. Before then, all doctors were trained outside of Gambia. So we went through a very tough journey, being the pioneers. And then we emerged. We started as 25, but only 9 or 11 finished at the end. After that, I had the opportunity to train a little bit in Taiwan. Then I went to Ghana. I specialized in Ghana. That's where I did my training as an obstetrician and gynecologist. So here I started in 2024 June, going towards my second year. For EFSTH, we have an act. The law guides us. It tells us how we should run, what is our aim, what are we supposed to do for the country. The second priority is to ensure that the basic needs of the patients are met. Before, if you come to this hospital, basic things like labs are not available. Full blood count was not available, basic things. But now, alhamdulillah, before if you come, patients where they are is very bad and all that. But now we are renovating all places. You have ACs, you have nice wards, toilets are clean. Before in this hospital, water was a problem. Water, it has used to be in the news, operations cancelled because of water and all. But we work with NAWEC, they were so helpful. Now, fire service used to help us a lot. But now we are at a level where most of the time the water issue is history. The other thing is the electricity. We work with Cornerstone. So theater now, if light is off, they can still operate because there's a solar system that backs up. So Sarufujete did that one for O&G, and Cornerstone did that one for the major hospital. Recently, First Lady renovated our urology. Now, if you go to the urology theater, it's so nice, state of the art. And the surgeries they do there, top, like it's no more open, transurethral resection of the prostate. These are like high-level surgeries that we are giving here, at very cheap rate. Like this last 5 years, we had support from Ministry of Health, from World Bank. We have highly trained consultants in different areas, radiology, pediatrics, different levels, family medicine. They are all from the sub-region, Nigeria, Ghana, and other places. They were brought here to help us train the doctors to come up. So the renovation is a little difficult for us because, renovating a hospital is not easy. The contractors, they wanted us to just give them the whole hospital, remove all patients. Within a short period, they will fix the whole hospital. But it cannot be like that. So we are always fighting with them. The government, everybody wants the renovation to be very fast. We also want it, but it has to be gradual. So the contractors, they come and say, give me this whole block. I say, no, I can only give you 2. So when you finish those 2, then I move patients, I give you another. But if you go to the places they renovate, it's very nice. So there are cases like the laparoscopic we do. Here, I think we pay minimal. But if you go to, let's say here, like you pay 5,000, 7,000 for a whole laparoscopy with all that. If you go to just Senegal here, equivalent is about 85,000. If you go to the cardiology unit, you'll be surprised. If you go to the pediatric surgery unit, we have a pediatric surgeon here. He's Gambian. We have few, and they are done by Gambians. We are open door policy. We want everybody to refer, private, public, everyone, because it's for all Gambians. Now, because of that, we have a challenge. The challenge we have is, because we are the only teaching hospital, we cannot refuse patients. In other hospitals, once the number of beds are full, then they say, sorry, we've closed. Like NICU. Our NICU, I think, is supposed to take sometimes only 40 children. But sometimes you go there and there's more than 80 children because we cannot refuse. If we refuse, there's a problem. So the escorts is a big problem. It's a Gambian culture thing. Normally in a teaching hospital, we should not allow people in. But you see, the problem is if we don't allow them, they are going to be lurking everywhere. So, like for example, if you go to the maternity, we don't allow escorts in, so they sit outside, there. But when it is at night, we open the door and allow them to use the foyer. So if you have bad intention, you can come and take a picture of that at night. I think the staff generally, they are doing well. We have, for our staff, they are well trained, because this is the teaching hospital. So most of the top staff are here. Sometimes I receive commendation messages. Yeah, it's something that makes me happy. Like almost every time now I receive, people text me, they say, one of your staff at Nemban. Recently I received this, is it charm, Makumba charm. They talked about how good he is. About 2 days ago, I received about urology, how professional they are. Somebody who doesn't, he told me, your staff at urology, I was there, Dr. So, Dr. Kajali, this is how wonderful they are. And he said further that the way he was sitting there amongst the escorts, some of the escorts were saying great things about them. What's in the offering is to start yearly. Yeah, we've not even done that yet, but the departments, they do, like the awards, each department, or they try to do that on their own, but not all departments are doing it. But what is common that we do is that when we go around and find a set of staff doing a wonderful job, professional, we write commendation letter. So the CMD or the chief matron will write that, the staff 1 or 2 has done this, and the EFSTH is grateful, something like that, and they appreciate that a lot. Our aim is, in the near future, nobody leaves the Gambia for health service. So that's what our aim, and we think we can achieve it. For the oxygen, we used to use the bottles. So the bottles, they are very expensive. Each can be 2,500, 3,000, 3,500, depending. It's very expensive. And for each patient, they can use a lot, depending if they have respiratory, and it's continuous, high flow. So it used to be very expensive, and it's free here. So it used to cost us millions. Every month we spend millions of dollars on oxygen. But now, with this oxygen plant, we don't have to ration. So anybody who needs oxygen, we can give you oxygen now. We don't need to ration it because we're getting it directly from the plant, and then we make sure everybody gets oxygen. Some of them who need oxygen occasionally, because if dialysis is done well, usually they're fine. You can come do your job, do your dialysis, and go do your job. It's not a problem. But occasionally, some people have acute kidney failure. They need oxygen as well. So those ones can also benefit. So like one thing about this hospital is that everything about this hospital is the responsibility of the CMD. So any bad thing here is Dr. Bittaye. Yeah. Any good thing is the team, of course. We are here looking out for the community. We want to make sure that everyone gets the best service. And once you reach here, we want to ensure that you have quality care. So let them not be worried about that. And if they see anything that they think needs to be brought to our attention, they can share. We will do our best to ensure that we sort it out.